So let's start with the basics. What is a psychopath? Well, about 1% of the general population is a psychopath. It can be as high as 25% of male prisoners. Obviously, that depends on the different studies, the different tests, and also which prison you go to. It might surprise you to know that psychopathy is actually a formal clinical diagnosis. So it's not in, for example, ICD-10, which is the classification system that we often use in England. But it is something that's specifically diagnosed by those working with mentally disordered offenders, such as forensic psychiatrists like yours truly. And it's usually diagnosed using the PCLR, which is the Psychopathy Checklist revised. It's a tool developed in the 1970s by Dr. Robert Hare, who's a Canadian professor and renowned criminal psychologist. So within the PCLR, there are 20 individual criteria, and the subject is scored either 0, 1, or 2, depending on the absence, partial presence or inconclusive, or fully presence of the particular criteria. Now, I'm not going to name all 20 features for you now because it might get a bit dull, but in a future video, I plan to actually use the PCLR on real life people, including Michael Jordan. There's a reason that I've chosen him, as well as maybe some fictional characters, so look out for those episodes. So I'm going to highlight for you now the key ones that I think particularly distinguish psychopathy as a diagnosis. In the interest of balance, I should say that in my opinion, some of the 20 features are not particularly indicative of this disorder, or they're a repeat or very similar to a previous factor, which obviously can skew the result. So to give you a quick example, early behavioural problems is one of the features in the psychopathy checklist, and so is juvenile delinquency. And I get that not all early behavioural problems are juvenile delinquency, but I think that there's such a big kind of overlap that it invalidates the need for both factors. That's just my opinion. I'm not trying to start beef with Dr. Hare. He did 3 decades of research into studying psychopaths, including prison inmates in Vancouver. I've assessed and treated a handful of psychopaths, but I've not researched them as a group as a whole. As is often the case with mental health issues, the general public misuses the phrase psychopath. Shame on you. I think when the average person talks about psychopath, they mean it to be somebody who is a bit unhinged or aggressive or violent or short-tempered. And as I'm about to discuss, that's actually incorrect. The vast majority of people who are very violent are technically not clinical psychopaths. And also psychopaths can often thrive without violence. And as to being unhinged, from my experience, as I'll outline in my next episode when I talk about a previous patient, psychopaths can actually be the opposite of that. They can be cold, they can be calm, they can be calculated, they can be the opposite of unhinged, hinged. They can also display equanimity even when committing violence. Equanimity, I love saying that word. I recommend at least 5 portions of saying equanimity every day. And if you don't know what equanimity means, go look in a dictionary. Okay, so here are the most important of the 20 factors from the psychopathy checklist, in my opinion. Psychopaths have superficial charm, so they need this charm to manipulate people. Also, they fail to learn from their experiences. So if you punish a psychopath, they might show humility, but a true psychopath never changes his spots. Psychopaths also have egocentricity, which is basically the whole world revolves around them. They only look out for number one. And they also have the incapacity to feel guilt for anything, and they're incapable to feel love or empathy for anybody. And I really can't stress that enough. It has to be for anybody. And in my mind, that's one of the key features that distinguishes a psychopath from just a normal violent offenders. So a non-psychopath can kill because of a particular belief or cause, but they can still show empathy for other people, such as their community in general or their family members. So these people are not clinical psychopaths. That's not to say that their actions aren't any less morally wrong, but I'm just saying they wouldn't fit the diagnosis of psychopathy. Psychopaths are pathological liars, and they're impulsive, and they're very grandiose. One way that I conceptualize it, and I'd invite you, dear viewers, to do the same, is this. Psychopathy is more about manipulation than it is about actual violence. It just happens to be that for some people, in some circumstances, violence is like an easy way to intimidate and to manipulate somebody. So a true psychopath will see everybody, even people that are close friends or family, as somebody who's an opportunity to take advantage of and to benefit from other people. And I say close friends and family, I use the word close loosely, because you could argue that despite physical proximity, psychopaths are never actually emotionally close to anybody. So a true psychopath cannot feel love and cannot even really be in love, although they might fool themselves into thinking that they can. However, somebody with antisocial personality disorder, for example, is not necessarily like this. I've talked about antisocial personality disorder in a previous episode. Go check it out. So they might have a lot of the same tendencies as a psychopath, such as impulsivity and aggression, but that could be due to their circumstances. So some people with antisocial personality disorder might condone violence and use violence, but they still potentially have the capacity to love other people like close family members. For some reason, when I was writing this, the character Jamie from Top Boy really personified this. So he's an example of somebody that might have an antisocial personality disorder, or definitely an antisocial lifestyle due to his circumstances, and he's a drug dealer. But he's clearly not a psychopath, because he shows genuine love and concern and affection towards his family members, such as his two younger brothers. In fact, I'd go as far as to say that most of the main characters in Top Boy show some form of empathy or loyalty towards other people. Hello, cruel world. What you just saw there was a tiny little tantalizing taste, kind of nutty, of a much longer episode. You should go check it out if you're interested. The link will be in the description below. If you're a fan of either true crime or mental illness, or the crossover between the two, then you've got to go and check out my main YouTube channel, A Psych for Sore Minds. My name is Dr Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. My channel covers a whole range, a smorgasbord of topics related to true crime and mental illness. For example, high-profile true crime cases with my own kind of personal psychoanalysis of individuals. I discuss issues related to criminality. I discuss individual diagnoses. I give advice about psychiatric problems. I interview ex-patients. I do a lot. There is something for everybody on my channel, and I implore you to go and check it out. You can even steal some of my ideas, palm them off as your own to impress your friends and impress people at dinner parties. It's all good. I've got your back. Until next time, stay euthymic, check out my channel, and please do not forget, I love you.